most of them will say that I need help because in very deep financial problems. Most of them call for help because of that. Some of them are just literally dragged in by the family, right? Dragged in. I have one patient dragged into the room by the ear by the wife into to sit down in a chair, right? Because he refused to say help. So that was very funny. But some are really they genuinely want to get treatment, right? They want to stop, and these are the very motivated ones. All right. One aspect of the assessment would be to assess the suicide risk. How dangerous is this guy? Is he going to kill himself today, tomorrow, next week? You don't know. So we have to assess, right? Because the financial pressure is so great, the harassment by the loan shark is so great. Sometimes a simple letter from the banks, you have not paid this loan, you still owe the banks money. All these are triggers, and sometimes this just push them to the edge. And then we want to assess for other comorbidities, mental health comorbidities, and really do a on the spot comprehensive mental state examination. Okay. So the diagnosis of pathologic gambling, as explained by Hussein just now, you need at least five out of 10. So in order to be a so-called pathologic gambler, but sometimes less than 5, right? 1 to 4. Okay, a problem gambler, someone with at least some problem in the gambling behavior, maybe also a pathologic gambler, but you need time to build some rapport before he or she can reveal more information for you to, okay, this criteria is also thick. So he is or she is a pathologic gambler. Right, we saw this just now. Okay, so the recommendation would be a comprehensive clinical interview that includes psychiatric assessment and mental state examination should be performed when assessing someone with a gambling disorder, and a multidisciplinary assessment is recommended. Okay, and the DSM-4 for PG should be used to evaluate and confirm the diagnosis of pathologic gambling. Okay. All right, so that's all for the first half before the tea break. Do you all have any questions before the tea break? Because we have a little bit of time. Yeah. DSM is it stands for Diagnostic and Statistical Manual, the 4th edition. This is the Bible for psychiatrists to use for the mental health professionals. You can actually go online and check it out. DSM, from 1 to 4 over many decades, it's evolved from DSM-1 already present in Singapore. There are people out there with gambling problems, but because of the casino, there was awareness. The NCBG was set up to create awareness. Right, you even see posters on the food court, the tables, right, the helpline to let people know that there's a help out there. So you may be seeing a rising number of people seeking help or calling a helpline, but it's actually due to awareness. But actually, the problem was already present